How many bowel movements a day is considered to be healthy? How many bowel movements a day is considered to be healthy? Bowel movements, often a topic of discussion that can be both uncomfortable and essential to our health, play a crucial role in our overall well-being. While what constitutes a normal frequency of bowel movements can vary widely from person to person, understanding what is considered healthy can provide insights into our digestive health and overall wellness. In this article, we explore the factors that influence bowel movements, what is considered normal, and when changes might indicate a need for medical attention. Understanding bowel movements, or stools, are the body's way of excreting waste products from the digestive system. They consist of water, undigested food particles, bacteria, and other substances that the body needs to eliminate. The frequency and consistency of bowel movements can vary based on factors such as diet, hydration, physical activity, medications, and individual physiology. Factors affecting bowel movements. Several factors influence how often a person has bowel movements. Diet, fiber-rich foods such as fruits, vegetables, and whole grains can promote regular bowel movements. On the other hand, a diet low in fiber and high in processed foods may lead to constipation. Hydration. Drinking an adequate amount of water is essential for maintaining bowel regularity. Dehydration can contribute to hard stools and difficulty passing waste. Physical activity. Regular exercise helps stimulate bowel movements by promoting muscle contractions in the intestines. Medications. Certain medications, such as opioids and some antidepressants, can cause constipation as a side effect. Medical conditions. Conditions such as irritable bowel syndrome (IBS), Crohn's disease, and thyroid disorders can affect bowel habits. What is considered normal? The definition of normal bowel habits can vary widely among individuals. In general, a healthy bowel movement pattern can range from several times a day to a few times a week. Factors that contribute to normal bowel habits include frequency. For some people, having one bowel movement a day is typical and considered healthy. Others may have bowel movements less frequently, such as every other day or every 3 days, without any issues. As long as there is no discomfort, bloating, or straining, less frequent bowel movements can still be normal. Consistency. A healthy stool should be soft and easy to pass. It should not be too hard or too loose. The Bristol stool chart is often used to classify stool consistency, ranging from type 1 hard lumps to type 7 watery. Ease of passage. Bowel movements should occur without excessive straining or discomfort. Straining can indicate constipation, while urgency or diarrhea may suggest underlying issues. Signs of healthy bowel movements. Regular and predictable. A healthy bowel movement pattern is typically regular and occurs without excessive effort or urgency. Establishing a routine can help regulate bowel habits. Comfortable passage. Bowel movements should be passed comfortably and without pain. Painful bowel movements or bleeding may indicate underlying problems such as hemorrhoids or anal fissures. Complete evacuation. A healthy bowel movement should feel like a complete evacuation, leaving you feeling relieved and empty. When to seek medical attention. While variations in bowel habits are normal, certain changes may indicate a need for medical evaluation. Persistent constipation. If you consistently have difficulty passing stools or experience infrequent bowel movements accompanied by pain or discomfort, it may indicate underlying constipation or obstruction. Diarrhea. Persistent diarrhea or sudden changes in stool consistency. Watery or loose stools may be a sign of infection, food intolerance, or gastrointestinal disorders. Blood in stool. The presence of blood in the stool can indicate various conditions, including hemorrhoids, inflammatory bowel disease (IBD), or colorectal cancer. It should always be evaluated promptly. Unexplained weight loss. Significant and unexplained weight loss, especially if accompanied by changes in bowel habits, may be a sign of a more serious underlying condition. Chronic abdominal pain. Persistent or severe abdominal pain, cramping, bloating, or discomfort that is not relieved by passing stool may indicate gastrointestinal issues that require medical attention. Tips for promoting healthy bowel movements. Maintaining regular and healthy bowel habits can be supported by adopting certain lifestyle habits. Eat a fiber-rich diet, include plenty of fruits, vegetables, whole grains, and legumes in your diet to promote regularity. Stay hydrated, drink an adequate amount of water throughout the day to keep stools soft and easy to pass. Exercise regularly. Physical activity helps stimulate bowel movements by promoting intestinal muscle contractions. Establish a routine. Try to establish a regular time each day for bowel movements, such as after meals, to help regulate your body's natural rhythm. Manage stress. Stress and anxiety can affect bowel habits. Practice relaxation techniques such as deep breathing, meditation, or yoga to help manage stress levels. Conclusion. In conclusion, understanding what constitutes healthy bowel movements involves recognizing individual variations and paying attention to changes that may indicate underlying health issues. While there is no one-size-fits-all answer to how many bowel movements a day is considered normal, maintaining a pattern that is comfortable, regular, and without significant changes in consistency or frequency is generally indicative of good digestive health. If you have concerns about your bowel habits or notice persistent changes, it's important to consult with a healthcare professional for proper evaluation and guidance. By paying attention to your body's signals and adopting healthy habits, you can support optimal digestive function and overall well-being.